Today is World Malaria Day, and as Levi Manawasa University Teaching Hospital, we join the rest of the globe in commemorating this very important day. Under the theme, Malaria Ends With Us, Reimagine, Reignite, Reinvest. Malaria has continued to claim many lives despite the various strategies that have been developed over the past decades in management and treatment of malaria. In 2023, about 263 million cases were recorded worldwide, with over 600,000 deaths. And among those that are mostly affected by malaria are children under the age of 5 and pregnant mothers. Malaria is a parasitic infection that is transmitted by an Anopheles female mosquito, and this mosquito would transmit the plasmodium into the human blood that would cause malaria. It can present in several ways and it affects various organs of the body. Some of the symptoms that a person who has been infected by malaria can have is they would have fever, headache, chills, sometimes nausea, vomiting, or even seizures. Malaria can be treated using various medications in the hospital and even at home, depending on whether it's complicated or uncomplicated malaria. We can prevent malaria through various means, and one of the ways that we can prevent malaria is by sleeping under a treated mosquito net, spraying our homes, and also using mosquito repellent whenever we are exposed to malaria or to mosquitoes that cause malaria. It's also important that we keep our surroundings clean, make sure that we do not have areas with damp water or even grass areas around the home that need to be cut, and to make sure that our surroundings are free from mosquitoes. Malaria can be treated as I have mentioned, and it's important that before somebody begins treatment for malaria, they should get tested. We have seen several people or cases in the community where they have started their treatment for malaria without even getting tested, or because they could have had a fever or even a headache. And it's not every headache or fever that translates into malaria treatment. So ensure that people get tested first. So if you have a relative, a friend who has symptoms that seem to be malaria symptoms, let them get tested first before they begin their treatment, because this is important, and it helps to prevent drug resistance, which we have seen developing over the years, which means that our drugs that we have been using for malaria are now becoming less effective because of malarial drug abuse in the communities. So we need to work together towards the end of malaria, and we need to reinvest in strategies that help to prevent malaria, and also reimagine some of the strategies that we can all incorporate in our day-to-day lives to prevent malaria and also improve management of malaria. And we need to reignite our commitment. Everybody needs to be involved in the fight against malaria to end malaria. So remember, nobody needs to die because of malaria, and so let's work together towards the end of malaria.